Hello, this is going to be a review of our virtual reality patient, Annette Stark. She's a 78-year-old female that came to us for having some shortness of breath. She reports it started yesterday. The pain and discomfort is non-radiating, and she feels like she can't just catch her breath all the way. She tried using her inhaler and didn't help much. Nothing makes it really better or worse, and she does not feel like she can get a full deep breath in. No pain with deep inspiration. She also has been having some cough with mucus as well. Patient does have a history of COPD and chronic pain due to osteoarthritis of her left knee. Her parents have a history of high blood pressure, cholesterol, diabetes, and COPD as well. No recent hospitalizations or surgeries. She does use an albuterol inhaler for COPD, singular inhaler for COPD, and naproxen is needed for her osteoarthritis. Social history includes she does still smoke, has been smoking for the past 55 years, drinks alcohol socially, denies any drug use. She currently lives alone, and no recent sexual history due to passing of her spouse. Review of systems is mostly unremarkable, with the exception of shortness of breath and speaking in 2 to 3 sentences with a visible slight to moderate respiratory distress. Her vitals are stable, BP of 140/78, pulse of 90, respiration 20, setting 90% non-room air, temp of 36.5, and she's about 5'9" and weighs about 150 pounds. For physical exam, she is alert, warning times 4, calm, cooperative, very pleasant. Like I said earlier, she is having mild to moderate respiratory distress due to speaking to 2 to 3 word sentences. She is appropriately dressed, speaking in appropriate enunciation and tone. Once again, her physical exam is mostly unremarkable, once again with the exception of respiratory system, which she's having mild to moderate respiratory difficulty, speaking 2 to 3 word sentences. Her lung sounds are coarse throughout with some inspiratory wheezing in all lobes, and symmetric chest wall movement. Respirations are slightly labored and regular. My differential diagnosis would include pneumonia, acute coronary syndrome, and pulmonary embolism, COPD, and/or CHF exacerbation, and any lung malignancies as well. Due to those, and to rule out all the etiologies we've collected at CBC, BNP, BNP, troponin, which all were unremarkable. Her respiratory viral panel was also negative for any antigens. Her chest x-ray showed some effusions bilaterally and bilateral hyperinflation of the lungs. CT chest for PE was unremarkable and showed no evidence of PEs. 12 lead was also unremarkable with normal sinus rhythm and no ST elevations. Based on all the data that we've gathered, I would diagnose the patient with COPD exacerbation, and I would do the following treatments. We can start the patient on albuterol and their dual-nib nebulizers, see if that improves her breathing and improves her oxygen saturation. Initially, it was 90% room air at our altitude level here. That is totally fine, but if we were at a sea level location, that would be low. Also, I would try a dose of a corticosteroid such as Medrol, 125 milligrams IV, and see if it'll help with her inflammation in the lungs. After medications, I will have the patient in observation for probably an hour or two to see if her condition has improved and to see if there's any rebound effects from the nebulizers and or the Medrol. Depending on the situation and our location, I would think about admitting the patient for further evaluation and treatment as well. If so, I would contact pulmonology and see what else their recommendations are. as well. If the patient is going to be admitted to OBS, I would also consult respiratory therapy to see if they can do a peak flow meter, which we actually did during the simulation, and hers came out to be 640 as well. Once the patient is discharged, I'm going to have her follow up with the primary care doctor to see how she's doing afterwards for a re-eval, and to see if she needs any adjustments on her meds or any further recommendations as well. Same thing, I would have her follow up with pulmonology and see what their recommendation would be on her matters and pulmonary condition.